Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Jesus here with us this afternoon, and Jesus has been coming in for the last few weeks with some neck pain and hiatal hernia with acid going up into his throat, and some pelvic pain that's been going down into his legs. That's called sciatica in a lot of cases, commonly known as, but the medical terminology for it is lumbar radiculopathy, and he's having some numbness and tingling down in his legs and his feet, and pain on the inside of his calf muscle as well. So it's sensory and motor. So we're going to show you how we treat that today. Let's take a look at you here first, Jesus. Okay, I'm going to have you close your eyes and flex your head forward and then backwards. We were just talking earlier about the number one reason that people have reoccurrence of neck pain and back pain, including myself, and that is forward head posture. And if you look at him from the side, you can see his ears dropping right here in front of his clavicle when it's supposed to be back here over your shoulder. See how that makes your shoulders kind of round? Mm-hmm. Now you see how your head's also translated to the right of center? This hand looks longer than this one. It's not really. It just looks that way because your head's translated that way. And see, your pelvis has shifted left to center. You got a lot more room here than you do over here. So this is Jesus' fourth treatment here. And the very first thing that I'm going to do with him today is decompress his spine from his skull all the way down to his pelvis, his favorite. Sure. All right, so let's go ahead and get you on your back right here for me first, Jesus. This is my favorite. My ring dinger. Okay, let's slide you up that way just a little bit. And where we want these pins is right on top of the pelvic bone. So slide up just a little bit more. That way I don't catch your fat in between here. Or your love handles, let's put it that way.
I was going to say, what?
Love handles sounds better. I'm got bigger love handles. But Renee and I have both been losing weight on Unikey Health Systems Fat Flush program, which we will have available on our website here within the week. Okay, let's have you take a deep breath in, let it all out, and just relax it. Oh yeah, boy, oh boy, that's a home run. Yeah. I like to call that one a ring dinger. Do you feel that all the way down? Yeah. You still kicking? Okay. There we go. Now let me have you kind of tilt right. Perfect. And now left. That's it. Good job. So you're moving smoother today. Did you notice that? Didn't hurt me near as much.
Not that much today.
Okay, let's roll over this way. Actually didn't hurt me at all. There we go. I got your head forward on purpose there, so let's let that go forward just a little bit. Now his legs are even right now, but the right one has been coming up short, and it stays even, but that still tightens up a little bit, doesn't it? And the right one does get a little bit shorter there at the end. So that tells me his pelvis is off, and you could actually see the obliquity of that. So I'm going to put him in a mirror image of that, and I'm going to start with the right sacroiliac joint. And I'm going to adjust the sacroiliac joint along with the ischium, which is the bottom part of the pelvis here, simultaneously. And now the left SI joint in the hip here, which is the femur head. There. And now I'm going to hit the sacrum straight superior to inferior on the y-axis, so it's similar to the decompression, only I'm pushing the sacrum, which is the middle triangular shaped bone, away from L5 here, because that's where he's getting the lumbosacral radiculopathy. And L5, straight P to A in the z-axis. L4, L3. Now you see the angle in my arms changing the higher I get. There's L2. There we go. Good job. I'm going to put your head down a little bit more here, Jesus. If you can scoot up in there a little bit. And let all of your air out. There we go. Okay. Yes, good job. There, okay. I think I got one more right here. Yes, sir. Good job. Feel that one?
Yeah, feel that one.
That was a deep one. Now your legs are exactly even. Let's just hope they stay that way. Yes, they do. Did that feel less tight that time?
Best time.
Okay, good. So, Jesus gets to be the lucky recipient of the turbonator this evening. White knuckle syndrome treatment here. This is very, very deep myofascial release, and it is a retooled jigsaw. So all y'all that want to say, hey, that's just a jigsaw, you're right, it is. Just had a patient retool it for me so that I could use it to get deep down into the soft tissues and help break up fibrotic adhesions. Okay, now he's been having calf pain all the way down into his left calf, right?
Yes.
So we're gonna, let's see here, we're gonna pull your pant leg up here on this side today. Get this. And I'm gonna use a high frequency vibration which resonates at the same frequency as scar tissue and neurological tissue. We're going to use that on his outside portion of his calf, which is the gastrocnemius muscle. You notice I'm going from origin to insertion and spending more of the time over the belly. Now on the inside of the calf is called the soleus muscle. The calf's actually made up of two muscles, the gastrocnemius and the soleus, and this is where you've been having most of your pain, right?
Right.
Right there. I bet you feel that right there too. And I'm actually going to change heads here and use this little knob here to get a little bit more pinpoint right through there, huh? I bet you it's going to feel a ton better after I get done. And I'm not putting any pressure on this at all. I'm just holding it with my fingers here. I'm going to use a little bit larger head on it now. The great thing about this Rapid Release Pro 2 is that it's got several different size treatment surfaces that you can use to get more specificity or more diffuse type of treatment. Now if you were as close as I am, you can see all the little hairs on his leg just bouncing around at the frequency. This is about 150 hertz if you use a tuning guitar meter, hertz meter. Renee and I tested it this weekend on each other at home. And it really helped my pain in my feet and hers. And I'm anxious to see how Jesus feels with this after I do this today. Good. Okay. Let's go ahead and turn you on your back now, Jesus. And I'm going to have you leave your pant leg up like that. I'm going to adjust both of your hips and low back from this end. Okay, let that relax. There you go. Now you're tightening up. Just breathe. Breathe. There you go. That's it. Feel that one in your knee and low back? Okay, now on this one, I'm actually going to start down here at the ankle. There you go. I know you felt that in your ankle and your low back.
Yeah.
So, I'm going to take this rapid release technology and I'm going to use this on his muscle in the front of his shin here. It's called the Tibialis Anterior. Maybe Renee can get in there close and show you how fast those little hairs are moving around. Very, very high frequency, which resonates with scar tissue and adhesions, and also it's the same frequency as the nerves, so it stimulates the nerves as well. And I'm going to use this more targeted hand to run right along the anterior tibialis anterior muscle all the way down into its foot. This muscle is the one that pulls your toes up. So when I do this, you probably feel that more now, right?
Yeah.
Especially right there.
Okay.
Yep. Pretty tender right there, huh?
It is.
This is a lot more powerful than it sounds, huh? Notice people don't talk a lot while I'm doing this.
Feels good.
Might be, yeah, it does feel good. Felt really good when I had it done this weekend. There we go. We'll relax it again. Very good. Okay, you don't want to use this too long either. Couple minutes to 5 minutes is plenty. Alright, so we're just going to make sure his shoulders and his ribs are lined up, because remember we're working also with the hiatal hernia on him as well. So let's have you take a deep breath in, let all of your air out. There we go. Good, okay. I'm getting way down deep and I'm grabbing the top of his stomach, which is called the fundus, and I am pulling that straight back down through the diaphragm into the lower cavity below the diaphragm. And then we're going to make sure his ribs are lined up. Okay, Jesus, just slide you down on the table where your legs are hanging all the way off. And put your arms like that. So we're going to adjust his acromioclavicular joints now, which is the AC joints. And then I'm going to get right on the clavicle where it attaches to his sternum, right there. Ah, come on. There we go. And then the anterior costosternal region is where the ribs and the sternum meet. There. There we go. Good job. Okay, now let's sit you up and face that way towards your knee. Now already you can see his posture has changed with his head coming back further. Just with doing that. And I haven't even shot him yet. There we go. Good. He's been having some shoulder blade pain too, right?
Right.
That's it. Oh yeah. Perfect. Let's lay back on your tummy for a second. I'm going to work that shoulder blade area for you. I'm going to get the rapid release back out and work on his rhomboids here right in between the shoulder blades and the spine. and his trapezius muscle up here. Now this right now, I've got the big flat head on there, so it's a wider, diffuse type of dispersion of the high vibration waves. But then I'm going to narrow it down more with this flatter head, and he'll probably feel this one more. Yep. And see, I'm not pushing pressure on it, I'm just holding it, but it still creates more pressure. Right there is where the pain was, huh? All the way up into here. Now I'm going to use the knob. This is the one I like the best right here. Right there, huh? You don't have to put a lot of pressure on this. The actual frequency, the high frequency of it does the work. See, it's not as bad on this side, but it's still sore right through here, huh? As you see him jump. I can pretty much make anybody jump in this office doing any number of my techniques.
I almost kicked you in the face.
Yeah.
Mostly because it was tickling though when he was doing my feet.
Outstanding.
Whoop-de-taw.
Yeah. And then I always play this game. Guess which line that movie's from? If y'all can guess that, put it in the comments. I'll get you one free adjustment. Yeah, that's better than it was, but I'm going to try to get this one more time. Okay. Yep, that's all of them. Okay, let's come over here in front of the mirror now. Your legs should feel better right now.
It does.
Yep, good. Okay, let's have you flex your head forward and backwards again. See, he's already got better range of motion. And take a look at now, his ears come back further. So it was hanging way up here in front of his clavicle. Now it's right here over his clavicle. So we came back about a ½ an inch, and we still got about a ½ an inch, 3/4 of an inch to go. But here's how we're going to teach him how to do that. Lift up with your shoulders, pull back with your rhomboids, clear the hands, palms forward, that tightens up the entire trap. And then we're going to have him bring his head straight back and then look up. We're going to tilt him and translate him a little bit left. If you'll shift your pelvis straight right for me now, Jesus, there you go. You'll feel a little tap right there. Another little tap right there. Now as you can see, his ear is over his shoulder right now. Okay, relax for just a second. I'm going to push this forward for you for just a second. Stretch out your trap and your rhomboids. I'm going to reset the muscle spindles in your trapezius muscles and your rhomboid muscles. All the way down to the insertion of the trapezius in the lower thoracic region. Okay, so now when you go forward and backwards, tell me how this feels compared to the last time. The range of motion is perfect.
Yeah. Feels better.
Yep. Now you feel like you're standing up straighter this time?
Yeah.
Yep. Look here, how we evened this space out now.
Oh, we did.
And your shoulders are right down the middle, head's right down the center. Good. Would you mind sharing with our YouTube subscribers what brought you here first of all, and how have you done in the 4 treatments as of today?
I've been doing great. I came over here for a hiatal hernia. I was having that, and then I was having shoulders.
And upper
pain.
back? Yeah.
Yes, I was having that in my lower back.
And you were
here.
getting acid coming all the way up in your
Yes,
throat.
I was getting upset, the acid all the way up here, and everything's gone down. I feel a lot great. I feel greater than I came in here.
Well, you're not having as bad acid reflux now, right?
No.
And
Thank you for the doctor here.
oh, well, thank you for sharing your story with us all. And we're coming to you from Advanced Chiropractic Relief in Houston, Texas. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.